And welcome back to Life Unrehearsed. Matt Delvecchio here. Thank you for tuning in on a cool Sunday. 12 degrees now here at the CJAD studios, corner of Papineau and René Lévesque. It is cool for early September. All right, now, according to the Centre for ADHD Awareness Canada, attention deficit hyperactivity disorder is one of the most common neurodevelopmental disorders in Canada, affecting approximately 1.8 million Canadians. Well, next month is National ADHD Awareness Month, and so today we're discussing the condition with Dr. Lily Hechtman. Dr. Hechtman is a professor of psychiatry and pediatrics at McGill University and director of research in the Division of Child Psychiatry. She's a child psychiatrist and an internationally recognized expert in ADHD. Dr. Hechtman's research has focused on long-term studies of children with ADHD, followed into adolescence and adulthood. Dr. Hechtman, welcome to Life Unrehearsed.
Thank you.
Well, thank you for coming on the show. ADHD, as we hear, it's 1.8 million Canadians. Is quite an astonishing number, and I would imagine it might even be underrepresented for some undiagnosed cases of ADHD. But let's start with what are some of the signs of ADHD?
Well, the key signs are inattention, as well as hyperactivity and impulsivity. Now, over the age span, what happens is that the hyperactivity and the impulsivity go down because the child often gets into difficulties because he's hyperactive or impulsive and can't sit still. But the inattention remains a problem and, in fact, becomes more of a problem. So you get a shift in symptomatology as the child develops into adolescence and adulthood.
And, we've heard and seen, and I'm sure you see it all the time, how that inattention affects schooling, and you could see how there's a domino effect. I've always wondered, though, Dr. Hechtman, is do genetics and the environment contribute to ADHD?
Yes, I think both do. This is a highly genetic condition. It runs in families. In fact, the concordance rate, which means if you have two identical twins, what are the chances of both of them being affected, is 80%. Now, that is a very high concordance rate, and its rate is much more evident in the monozygotic compared to dizygotic twins. So the twin studies really emphasize the genetic component of it. However, we're also aware that other environmental situations give rise to ADHD. So difficulties during pregnancy, with birth trauma or illness during pregnancy, radiation exposure, concussions. So there are a number of genetic causes, but also some environmental causes.
Listening to Life Unrehearsed, Matt Delvecchio here, and we're talking ADHD with one of the experts, world internationally recognized Dr. Lily Hechtman. Dr. Hechtman, how can parents better support kids with ADHD?
Well, these children, because of their impulsivity and lack of concentration, do need quite a bit of structure to help them with routines, with remembering things, with being on top of things. And early on, I think the parent needs to be significantly involved. And gradually, as the child is able to take on more things autonomously, then to step back and allow him to do it as he shows that he is keen on doing it and is able to do things. Mm-hmm.
It's my sister helps with special needs kids in the classroom. Ironically, it's her birthday today. Happy birthday, Alana. And she's involved. She sees kids with special needs, certainly including ADHD. And Dr. Hechtman, what can be done in the classroom to accommodate students of all ages with ADHD?
Well, I think that because of their attentional issues, they may need help with organizational skills, with keeping an agenda, keeping on top of what they have to do and when it's due, and making sure they actually hand it in. Even though they've done it, they often don't hand it in. Sitting in front of the class, near the teacher, the teacher having some kind of eye contact with them. So if they're off task or their mind is wandering, she can kind of just touch their shoulder and they get the message that they've been inattentive. In addition, to sit close to the blackboard so they see and can follow what is being taught. However, we do sometimes recommend certain accommodations. So, for example, getting extra time for assignments and exams, doing the exam in a quiet room where they're not distracted. Sometimes the use of computers focuses them even more. So depending on the individual child and where their deficits are and what they're having difficulties with, the recommendations for accommodations might differ.
Talking with ADHD expert Dr. Lily Hechtman here on Life Unrehearsed. You know, things have developed with research over the years. It's certainly not the same as it was 10, 20 years ago. But Dr. Hechtman, what would be one of the common myths that you hear out there about ADHD that you encounter?
Well, I think the people feel that if you have this condition, you cannot be a success, although we have very many people in the public eye even who talk about having ADHD and being very successful. So, for example, I know a lot of the adolescents and children, and we've just watched the Olympics. For example, Michael Phelps, who's a multiple gold winner in swimming in Olympics, he has talked about his ADHD and his difficulties with it, and he's been very successful in his sport, and now he's a coach and is bringing up the next generation of stars. Sometimes you have business leaders as well as academics who are very recognized in their field, and sometimes they get an assistant, a junior person, a rep secretary, somebody who helps them get organized. And I know one person who was a lawyer who had a lot of difficulty being a lawyer because of his ADHD, and he had a secretary that really helped him a great deal in terms of being very organizing, making sure he had all the documents he needed for court and was really on top of things. So there's help out there, both in terms of actually treating the ADHD, but also getting a support system that helps you succeed.
And absolutely, and you are a big part of that, Dr. Hechtman, and it's nice to see, just to have it recognized. So many years of, previous generations went unrecognized, and now it is very much front and center, and it can be treated and with a nice support network. And thank you all that you do, Dr. Hechtman, in helping families dealing with ADHD. That's Dr. Lily Hechtman, a professor of psychiatry and pediatrics at McGill University and director of research in the Division of Child Psychiatry. Coming up on Life Unrehearsed, did you know that September is Suicide Prevention Month? I'm going to be talking to a courageous young woman who lost her brother to death by suicide. She'll be telling her story and offering words of advice to families who may have a loved one that is struggling. That's going to be coming up after a CTV News update.